I know that in the last couple of days, weeks, people have been worried about the variants. So we've spoken about that last time as well, but I think there's probably some evolution already because everything evolves by the minute with this. So I just want to ask you to start, what do we currently know about these variants?
Yeah, so there are several variants of concern that are circulating globally, and they're going to continue to do so in the foreseeable future. So like all life, the virus that causes COVID isn't stagnant. It's something that changes with time, and it's not perfect, just like humans. So it does make errors in its genetic code. It is a bit unique in that it does have an error check, unlike some viruses of the same type. So it can create some proofreading that permits it to remain relatively stable. That said, it does have some errors that can accumulate over time, and these errors can result in changes in amino acids, so some of the proteins that the virus actually makes. And when there's a certain number of errors in the proteins, particularly ones that are really important for how the virus binds to our cells in order to infect our cells, that's when we sit up and we take notice and we say, oh, this guy right here, this new lineage right here, we're a bit worried about that. Let's take a look and investigate what's going on with him. So some of the variants of concern that we're watching very closely have mutations within the spike protein, which is the protein by which the virus uses to enter human cells. So if you imagine, it's like this beautiful master key to all of our cellular houses. And it seems in some cases with these variants that the key becomes more perfectly shaped to all of our house doors. And you can imagine if that's the case, then you need a little bit less virus in order to infect you, because it's very adept at getting inside. So that's what is really concerning. And when we talk about the virus or some of these variants being more transmissible, it's probably because they can enter with a lower infectious dose. That's one of the hypotheses. Not necessarily that they're, suddenly have grown wings and they can zip through the air with more ease, but just that you need a little bit less of it to probably infect another host. Other things that we are concerned about with the variants, sorry, I'm rambling, is two other features. One is that it might be able to evade our immune system's detection or our vaccine-derived immune system. So there's two things that we kind of worry about, is whether or not you can have reinfection after you've been infected by wild type virus, or after being vaccinated, whether or not you can become infected because of some changes in the genetic code. And then the other thing that we worry about is whether or not it makes the person more sick. So whether or not the virus is more pathogenic, and the jury's really out on that one. Certainly some of the variants that we're watching have been shown to have a less robust immune response post-vaccine. So Moderna looked at the South African variant, and they found that it was a 6-fold less production of neutralizing antibody in those individuals that were vaccinated with Moderna. That said, it still surpassed the level that was produced, still surpassed what was needed to stop the virus. So it still works, but maybe a little bit less robust of a response. So those are all the things we're worried about, and we're watching very closely. And locally, we're tracking at the lab level all positive tests by looking for key mutations that might suggest a variant of concern.
That's great, because you answered 3 of my questions in there, so that's amazing. I don't even have to do my job here. I think you touched on something that a lot of people are worried about. The vaccine campaign is going on right now, and more people are getting vaccinated, but people are afraid that the vaccine is not going to protect from these variants. So what would you tell people who are worried about that?
I would say right now, the evidence that we have shows that the vaccine does work. And, the variants are circulating, but at low levels percentage wise compared to the majority of what is within the community. So the vaccine certainly works at what else is out there. So I would definitely recommend to pursue vaccine when it comes your turn in line to get the vaccine. We know that it does prevent severe illness and hospitalization and all the bad things we think about when we hear the word COVID. It certainly might actually prevent people getting infected, even mild illness. And those are fantastic things. We want to protect those that are most fragile from having the most dire consequences of the infection. And we also want to prevent those that are in direct contact with the most fragile populations from transmitting to those individuals. So if we can do those two things, then we can dramatically reduce our cases and hopefully get back to normal sometime soon.
That would be very nice indeed. And now this week I actually went to speak with people who were part of the first mass vaccination campaign happening in Montreal. And a lot of them were telling me they were excited to get back to normal and all that, but they were only getting their first dose. So what can people do after their first dose in terms of, can they see people? Can they are they still contagious? I think there's still a lot of questioning surrounding that. We know that we have to get a second dose, but what happens after the first one?
Yeah, so we don't have a lot of data with respect to the efficacy of one dose. We have some data from Pfizer's studies, Pfizer-BioNTech studies, which looked at the small interval of time between the first dose and second dose. We do have some data from Moderna that looks for a little bit of a wider time, up to about 42 days after their first dose. And we do have some data from the UK and places where it was rolled out very rapidly, but not necessarily with the messenger RNA vaccines, more with some of the adenovirus vaccines in terms of the efficacy following one dose. I think, regardless of that, some protection is better than no protection. So if we even have a 50% efficacy at preventing disease or severe disease, that is a very positive step in the right direction. But it doesn't mean that we can, rip off our mask and run around barefaced in the world. I think we still have to be very tentative and maintain all the good infection control practices that have kept us safe thus far, at least until we not only get the second doses in our arms, but we get more of the population vaccinated. Because once we achieve that, once we have good vaccine-derived immunity throughout the population, then we can start relaxing some of our infection control, public health measures, and shave our mustaches. I have to wax mine, get my teeth cleaned, do all the things, but at least do makeup on the lower half of my face again. All the things that we used to do, and now we've taken for granted not having to do it.